Well, this has been extremely informative, and before we close, I would just like to ask each of the panelists, do you have any final thoughts that you would like to mention with regards to the things we've discussed today, the diagnosis, management of narcolepsy? Any final takeaway points for the clinicians that are listening?
Well, you know, it's exciting time for us in the field because new treatments are being developed now, and we expect more in the future. And I think that that we're doing a better job of identifying those patients earlier. I think this long gap of development of symptoms to diagnosis, we're working to whittle that down. I think we're doing a little bit better with that, but we're going to continue to do that. So I think we could all say we're going to still be working on this problem throughout our careers, and I think that's exciting personally, but also professionally.
Karen,
You took mine.
last thoughts?
But I think the additional comorbidities with narcolepsy are something to emphasize. In pediatrics, we didn't mention it, but precocious puberty is actually not uncommon, so up to 20% of patients will have that. Obesity can be a real struggle for patients and present in up to 70% of patients. Mood disorders, cognitive difficulties, and other endocrine problems have been reported, and then the hypertension that was mentioned here. So there is a strong role for the primary care provider in the care of a patient.
Yeah, I'd just like to say that, any patient who has sleepiness, you have to think about narcolepsy because so many of these patients are misdiagnosed or underdiagnosed. And it's such a devastating condition for patients that it's so important to be recognized and effectively treated. And now, of course, we have effective treatments available to us that we can make really big differences to these patients. So it's essential that physicians keep an open mind when they see anyone that's sleepy. And even though they do have these other conditions like sleep apnea or they may be a bit sleep deprived, consider the possibility, could they also have underlying narcolepsy? Evelyn?
Yeah, and I want to add also that in a group of people, young adults, teenagers, older teenagers, in school, they're all sleepy. But if one continues to be sleepy, just think about it and don't say, because I've heard that many times, oh, but they're all sleepy. The first hour, they're all sleeping through my class. So that is one thing, and closing the gap, very important. Also for society, economically, it makes sense that people will be productive members of society, that they can work, that they're not going on disability, but with medications, with the proper management, that they can be productive members of society.
Lon, any final thoughts?
Sure. Well, this has been a wonderful discussion, and it's really a privilege to be here speaking with you. The one thing is, when you look at and you read the literature about narcolepsy, it's often the epidemiology starts that this is a rare neurologic condition with such X, Y, and Z manifestations. And I would say that this is not a rare condition. This is an uncommon condition. The statistics of narcolepsy are very similar to multiple sclerosis. And if you think that this is rare, you may not be looking for it. So I think we have to keep our radar screen and know that the challenges still remain in making the diagnosis, given the tools that really require us to go through the sleep diary, sleepiness scales, and sleep tests that have to be done correctly. And that's, I think, still remains a challenge in addition to some of the gaps in the medications.
Well, thank you all very much for your participation in this panel. I think it's been extremely informative. I've learned a lot from you all, and I'm sure everyone else has too. So on behalf of our panel, we'd like to thank you for joining us. We hope that you have found this Neurology Live peer exchange discussion to be useful and informative.